taxes. I don't know. You know, Ashley, it's
Yeah, we definitely did not miss.
Easter. I mean, I use it.
Sunday afternoon.
Very, very good. It worked well for the 2 weeks I had it. And it worked.
Oh, we had 75, you know, and we worked at the sheriff's. My wife would stay up till midnight. Midnight.
Yeah.
Go out and check her. We're gonna do it. Well,
We're going to a.
we lambed in February.
Yes, dude.
Well, because I kept waiting for him near.
I'm out there and I got, I mean,
He's not going.
on this triple.
I think he's somewhere.
I got one ewe lamb in
Yeah.
here. Yeah, stupid. You know what? And I look over there and I got another one over there. I'm going, "There's not missing.
Bad attitude.
I go outside and she's got a set of triplets.
Because.
So I put,
Yeah.
I did it, bro.
Oh, I saved everything.
I'm just,
Several months.
Yeah.
hotel.
Somebody found I'm drinking a couple.
I suppose we probably need
We
to.
had lambs last night.
Depends on if we are getting home.
Out of the 3 ewes, I had 9
That
lambs.
seems to think we are, because I might have told her.
All in the heat, the 3 that were outside, I had haired out there.
Yeah.
Trying them with this. It was just.
I have it on my calendar.
One in February,
Maybe wrote it down. So
had triplets outside of the barn, and had access and everyone.
Yeah, I don't know how I saved it.
Yeah.
If I hadn't. Well, good morning, everybody. I'm gonna call the meeting to order this morning. Thank you, everybody, for coming in. We're gonna start off with the, I don't know how we got approval of minutes on there ahead of the pledge, but let's start off with the pledge, please.
Pledge allegiance to the flag of the United States of America, and the republic for which it stands, one nation, under God, indivisible with liberty and justice for all.
All right. Everybody have an opportunity to look at the minutes from last month and
The ouch.
The second,
we've got a motion and a second. All in favor, say aye. Opposed? Motion is carried. We're gonna open it up to public comment. I don't think we have any public comment this morning, so we will move right along. Judge Barna cannot be here this morning. She wanted to be, some of the agenda items were at her request. She has some health concerns that she's taking care of this morning. We won't go on beyond that. Information from Russ County Public Health Department. So Ashley, I see you brought your highly skilled and capable.
She arrived before I did. But Rich and I have been talking, I sent out to the group all of our services offered per department, so all 7 departments. So I sent that in the email. I did bring beautiful color copies if anybody is interested today. But then Rich sent an email kind of like, hey, maybe we should highlight a department in your department at each meeting. So I was like, okay, I guess we'll do that. No, but I think it's a great idea for the supervisor.
She sent me an email back and said, you must be kidding.
I think it's a great idea that the supervisors come and talk about their respective program and everything that's offered inside their departments. So first up is Kaylee in our public health department.
Yeah, so thanks for having me, guys. I've got some information, probably the same sheet Ashley has, but also some of the program sheets. And my business card, if you have questions afterwards or ideas, don't be afraid to reach out. So public health. Our focus is the overall health of the community. So like, we don't look at, you go to the doctor's focusing on you. Public health is looking at the community as a whole. So we do that through all different ways. We do, actually, I'm gonna skip you. I didn't burn it off. We assess the health of the community like on a large scale, at least once every 3 to 5 years. Typically, we do that with the hospital. We did that the year I started, 2023. We did like surveys with the whole community, kind of getting what they thought the biggest issues were. We did focus groups. We looked at data. And then based on that, we come up with a community health improvement plan, which is kind of where we are right now. This cycle, we're looking at like ways to increase physical activity in the community and then ways to just kind of promote mental health and decrease stigma. And like, we don't have the resources to have a mental health counselor in public health. We do to help people before they get to that, to give them coping skills, to promote overall wellness. But then I'm thinking Ashley wanted me more to talk about program specific that would help the people we're working with on a day-to-day. So that's your purple sheet. So first up is WIC. I'm sure you all have heard that SNAP is like on hold right now. WIC is still going through November for sure. So if you have any people that are pregnant, postpartum, breastfeeding, any clients that have children that are like under 5, they could qualify for WIC. It would give them nutrition fits. So you would just need to reach out to the WIC office or an appointment. They could assess all that. WIC also does a lot of like other coordinated care, like they can do lead testing because we want to make sure kids are having safe environments. If they have elevated lead levels, that can cause all sorts of health concerns like low hemoglobin, decreased learning abilities. So we do blood testing in the office. We can do hemoglobin testing. They refer a lot to other programs in Health and Human Services. They can refer, if the family's really struggling, like Indian Head has a home visitor program and they can kind of coordinate. They're really good to like just coordinate resources, make people aware of what's available in the community. So WIC was the first one I wanted to highlight. Also, we coordinate trying to bring dental access so WIC clients can qualify for dental care. We have Bridging Brighter Smiles that comes in once every couple months and they can do teeth cleanings because we know like access to dental is a big issue in the county for clients that are on Medicaid or have no insurance. There's like only one dental office that takes Medicaid. So a lot of times there's a big waiting list. So we try and like kind of bridge those gaps where we can. Like, is it perfect? No, but it's like we do what we can. So that's something we offer. Maternal child health. We have one nurse that kind of can do any like prenatal care. Like if people want to know, like have questions about like what they should be getting ready for or what they should do after the baby comes. If they have concerns about postpartum depression, we have a nurse on staff that can kind of help with all that, help with kind of the same thing you'd go for like prenatal, before the baby's born at the hospital. But since nobody does OB in the county and they have to drive an hour, we try and bridge that gap and they can come to us. We also do weight checks. We've seen more of that where after a baby's born and the provider's worried they're not gaining enough weight, they want them to come back to Hayward or come back to Eau Claire just for a weight check. We can just do that in the office and fax the provider the results. save them the trip. We do a lot of work like for safe sleep, trying to promote like not co-sleeping with your baby, making sure baby has a safe spot to sleep. So if they don't have a crib, we can get them a pack and play. It's at least the baby can sleep there for a couple months, so they can qualify for that. We have a car seat safety technician on staff that can check their car seats, make sure they're installed correctly, that they have the right size. If they have questions about it or they don't have the right size, we have resources to get them a car seat that will work for their baby and make sure they know how to install it correctly. Then immunizations, the Vaccines for Kids program covers all childhood immunizations if the child has Medicaid, has no insurance, or is Native American or Inuit. They can come to the office, get any vaccine at no cost. We also have vaccines for adults. Those are more limited just because there's less resources allocated to that, but we can get like MMR shots, flu shots. I think we have COVID and like the shingles vaccine. So if adults have no insurance, they can come in and get that or office. Birth to 3 is a program for like families if you have a child that they're worried may be delayed, maybe WIC has seen them and thought the child may be having some sort of delayed development. They can be referred to Birth to 3 that can provide in-home occupational therapy, physical therapy, speech therapy, and just kind of wrap around that coordination of care to try and give that child a chance to like make gains so that when they are ready to start school, they're ready and not already starting school, 6 steps behind. So parents can self-refer to that, or they can talk to their provider and get referred to that. And then reproductive health services. We take Medicaid or family planning only service, which is like through Medicaid, and like most people are single, like would probably qualify for that. They can come to us for like health screening, like kind of come up with a reproductive health plan. If they need condoms or birth control, we can do that. We also do STI testing. We do it in office for female clients to test for like chlamydia, gonorrhea, or trichomoniasis. Male clients, we have to take a urine sample and send it out to the state lab of hygiene, but we can offer all that at no cost. And if they come back with an STI, we give education. Well, we give education if they're tested anyways of how to prevent it. And then if they come back positive, we give treatment. And that's like if they're in the jail, we've done STI testing for inmates and things if they want. So we don't offer like AIDS testing, but we can coordinate that if that's something. Sometimes we have resources to try and find somewhere for them to get that done. Then well water testing is available for no cost for families that meet income restrictions. Typically, if they qualify for WIC or food share, they qualify for the free well testing. They just take a sample, we mail it down to the state lab of hygiene. They can test it for bacteria, like manganese, arsenic, like the common contaminants, just because those are pretty detrimental to like, little children. So then if they do come back high, then we can work on how to correct that. And then the last couple are just kind of educational things we offer. We do mental health first aid, which is kind of to like equip community members, like how do you deal with somebody that's maybe having a mental health crisis? How do you recognize, are they just having a bad day? Are they in a full-blown crisis where we need to call the crisis worker? So it's just kind of training for community members or anyone, I guess, that's interested in learning more about recognizing signs and symptoms and then how to address it. Usually like about a day-long program. We're offering that at no cost because it meets those community health improvement goals of improving mental health. And we have a grant from the CDC, so that for now. We also offer Narcan and Narcan training. We have the Narcan box on the law enforcement entrance. We have it available at public health. Just trying to kind of destigmatize it. I carry Narcan. Just if you're in the community, I feel like it's not a bad thing to be able to save someone's life if they're overdosing, whether intentional or accidental. So we offer training how to use Narcan, how to recognize signs of overdose, and then it is available to anyone that wants it. And that's from the opioid settlement grant money. So it's like at no cost. A lot of times we get pushback where people are like, why are we paying for Narcan? It's at no cost to us, to the county, to the taxpayers. And then Red Cross, we have one of our nurses is CPR or trained to do Red Cross CPR, AED. So the babysitting class, I didn't include that on there, but if people are interested in any of that, we have a nurse that can do that. All right, that's kind of the fast and furious view. Any questions or?
Kelly, with obviously everybody's facing budget challenges with the shutdown and
Sure.
budget cuts and everything else. Going forward in your future, what do you see as effects on your program?
It's very like, well, we do a lot of emergency preparedness work, which like we have the emergency manager that kind of is supposed to, you know, have the county ready if there's an emergency, what the issues are. Public health kind of looks at the people. So we get funding from the CDC for that. This year, we only got like 2/3 of our funding and it was kind of delayed. And then eventually we did get the other third. So there's always, I mean, everything, vaccines are kind of a hot topic at CDC with disagreement between different groups. I mean, we haven't heard that anything's being cut, but recommendations keep changing. So WIC is probably the biggest one right now with the federal shutdown. They are at risk of like having funding in December if things don't get resolved. Right now, they're good through November. They took farm subsidies and rolled that in to cover benefit so that they could get access to food and everything. So
Kaylee, you know how to get a hold of us, but a couple of our grants just started and our concrete support funds are full. So if families need formula, diapers,
awesome.
we have funds right now.
That's great because WIC definitely promotes breastfeeding, but they also realize not everyone can breastfeed.
We've had people already calling us because certain types of formula haven't been covered right now.
Because
So
they can buy a formula with WIC. And then if they have a doctor's referral, sometimes they need like a intense, like a,
yeah, we had to buy some specialized for a
Right.
family just now that was in Head Start. So we do have funds right now. I mean, it's not a plethora of funds, but it's enough for the people that really need it right now. We got a couple, like probably $10,000 in concrete supports. So
awesome. Yeah, that is definitely a concern. Like, you know, how our family's gonna be able to afford their formula if they're on a specialized formula.
so we can, and you know, Allison, Aaron, and they,
Yeah, I just saw you guys yesterday.
Yeah, so-
Allison yesterday.
yeah. So you guys know how to get a hold of us, but we do for emergencies. We have funds for that right now.
Okay, and I'll let WIC know. And like I said, they're good through November, but
I'm sure Kayla probably know, she talks to Allison and Aaron all the time, but just so you know, we do have funds right now.
okay, good to know.
Obviously, we deal with the criminal justice aspect. How best could we interact with your department that you could help us or we could help you going forward? We're probably dealing with a lot of the same individuals.
Sure. Oh, I mean, we do get calls or emails saying like, hey, do you guys have, we have an inmate that wants the flu vaccine, can you guys do that? And things like that. So I feel like, I think even maybe on like their intake, is there something like if they want an STI visit or questions? Because I think we've got.
When they do their 14 day with the nurse goes over that.
Okay,
If they are that,
right, because we've had some where like, a call saying, hey, they want to get tested for STIs and we come over and run the test, so. Yeah, I mean, I guess if there's something, even if you're like, this is a crazy thing, I don't think you guys do it, but don't be afraid to holler. Even if we don't do it, a lot of times we have, we might know someone that does, like, Head, or maybe the free clinic in Rice Lake offers something that they, use, or there's, how do you get transportation to a doctor's appointment? It's like, we obviously don't transport people, but we can tell you how to navigate the system, or so I guess basically, yeah, just don't be afraid to reach out, even if it's seems like a crazy request or a weird ask. Sometimes we have ways of connecting.
Okay, anybody else have any questions? Haley, thank you very much for coming down.
Thank you.
All right, thank you. And if you think of anything afterwards, like I said, my card's there. Don't be afraid to reach out. Or tell Ashley, she'll know all the answers. I do have a couple extra WIC and reproductive health brochures. If anyone wants them, feel free to grab them. Thank you.
Lauren from Indian Head. Thank you for coming in today.
Oh, yeah. I think I have to come every now time now, last time, so. No, I don't know, I can touch base on a couple of the programs that have changed a little bit, and then I can touch base more on what the Family Resource Center can do for this group right now. Obviously, I'm representing all of Indian Head, I just oversee the Family Resource Center and home visiting, but a few things that have changed. Our legal assistance for victims program, unfortunately, the OVW grant we did not get. We scored really well on our grant, but we did not get the letters of support we needed to get that grant funding. So unfortunately, LAV can only help people with children right now through the WIS staff grant. So unfortunately, if they don't have children, we can definitely find resources for victims, but we just don't have the funds to support anybody unless they have children right now due to not getting the OVW grant. That grant was also going to cover supervised visits and safe exchange. So since we didn't get it, we're still offering those things. It's just at a cost. Either I know that the county helps out every once in a while paying for that if it's part of their case management. But if it's court ordered, I know Judge Barna's court ordered quite a few families that have paid out of pocket. It just gets kind of spendy. So I was hoping to lower those costs, but I guess if they want to do the supervised visits, they got to pay. So we've been doing that. Those are still available. Like I said, just at a cost. We're constantly looking for funds to cover some of that or lower it, maybe do a sliding scale for parents. So if they do have some funds, they could, want to show that they're making that effort to be there. So payment is part of that. It's $45 an hour during office hours, but then 90 after, because we have to have 2 staff present for safety because we can't be alone with children. So it gets a little, we've been able to not do 2 staff every once in a while because Health and Human Services has provided a case manager for some. And so we've been able to offer at a lower cost, but it's a little pricey, especially if they got a visit or 2 each week, for an hour or 2, it gets expensive. We're still looking for funds to lower those costs so that we can continue to offer those. We are continuing to offer, just wish we could do it cheaper. We do have concrete support funds, like I just said. So I know families are really stressed out with this government shutdown when it comes to formula, gas cards getting to work, just things in general. We can really help with anything that is. The concrete supports are not limited to certain things. So if it's going to help the health and safety of the child or improve the parent situation, we can probably purchase it. Just have to figure out what it's for. Like gas cards, we only do for work or doctor's appointments, not just to go out joyriding. So they do have to provide us with their work schedule and a doctor's appointment note to prove that the gas card is for that, because we've been burned before. So we had to put some stipulations in place. But another thing that we are excited to start, which is one of the reasons that I started coming to this meeting, is we did not get funding to do it, but we're going to do it anyway. We're going to pilot a program. We really want to start reaching out and seeing what the interest for parenting in the jail is. We have a lot of different courses we can do, whether it's dads, moms, pregnant people with children that they just don't really have the emotional attachment with, maybe because they've been in and out of jail a lot. So we have a lot of different programs to really cater to whatever the needs are. We've heard in other counties that parenting is one of the main requests in the jail for classes. And I'm not sure if that's here in Rusk County as well, but it's definitely something that we are trained in. I have 3 staff that are all trained in the same program. So we could really start piloting a project, because then if we're doing something and showing some, interest and attendance, we might be able to put that into a grant eventually. But since we're not really doing anything with it and just wanting to start a new program, nobody wants to give you money to start anything right now. They want to give you money to just keep it right now. So if we do have some funds that we could use to start that, like a pilot project, and then just really start looking for funding to keep it going, because we also have a program where we can work with them once they're out to continue those parenting. And we're hoping that if people can connect with their children and become emotional with leaving them again, it might help with recidivism. We've seen it happen in other counties. So that's something we'd really like to start eventually. So, and I feel like the people in this room are people that I should be talking to about that. And so those are things that we are able to do. And then we are also able to do court-ordered parenting. We've been doing quite a lot of that. Judge Barna's referred people to us. And our parenting is from all spectrums. It can be from pregnant moms and new dads to people with teenagers. We're trained in triple P teens. So I know teenagers are a whole different realm of parenting. So we can work with that as well. And then we also have courses where we can work with emerging adults. So like maybe some troubled teens or things like that, working with them and kind of doing it's called an emerging teens cafe, where we sit and talk about what do you want to, what are your goals? What would you like to do? And then kind of creating a support system for teens that maybe don't have a lot of guidance in that. So there's a lot going on when it comes to parents and things like that. There's really not much we can't really do with them. We can kind of work something in to work with whatever's going on. But when it comes to the criminal justice system, that's something that we're really been diving into is that supervised visitation, looking to get that parenting in the jail. And then we're also trained in recovery cafes. And we have a parent that I think she did graduate through drug court a couple of years ago, maybe. And she wants to help host the cafes. She's been sober, and it'd be a good place for parents with children to come and talk about what it's like to be a parent and be struggling with addiction and staying clean in a small town. You know, it's hard when you can't leave the people that are your people getting you in trouble, you know, so it's hard when you can't just pick up and move. So it would be nice to have those little support groups as well for people with children. So some of the things that we're working on right now.
I think one of our major challenges is with the people in recovery court and have gone to treatment, try to avoid bringing them back to the same environment they have, but unfortunately, Ladysmith doesn't have a heck of a lot of resources. So housing is always an issue. You have anything that will help with housing at all?
Well, we have the CSBG program that can help with like down payments and rent and things like that. I do believe that the funding gets replenished here in the new year. I can't remember what the grant contract is for that one. CSBG does run out and people can only use it once a year, but I do believe it's that community block service grant funding that CAP agencies get. So we do have that to help with that. We do have a housing navigator too, like through that we can help find resources. But I mean, housing's such a hard one. It's a hard one to find resources for, but we do have that assistance for down payments, rent. If anybody is a veteran and facing eviction or homelessness, we do have services for that. There's funding to put them in housing. I believe they found housing for 85 vets this past year. So, you know, Angela's out there in the parks, you know, looking out, like, because we don't have people knocking down our door. She's out finding people that are homeless and like that. So if anybody in drug court or anything is a veteran, they would qualify for those services. I mean, Indian Head, the nice thing is if you call and we don't exactly have the service, we'll help find it, you know. Part of our mantra there is if you call, we'll find something even if we don't have it. But right now, housing is a hard one. I do know that we are working with a grant right now that we're hoping we get because they're kind of just telling us we have to write for it because Salvation Army is relinquishing some funds, which would help with housing for 17 to 24 that may be aged out of foster care. Maybe don't have parents present. And so we're hoping to hear about that one soon. So maybe next month I might have an update. But right now, those are our resources when it comes to housing. We definitely have some funds to help pay for that down payment and first month's rent, but that's about all we've got right now.
You mentioned troubled teens going forward, and you know that's kind of my area also. But the biggest thing that I see trending right now is vaping, and then vaping the THC. And
we have a whole curriculum of parent cafe topics for that for teens. And talking about, you know, why are they doing it? Is it peer pressure? You know, what the health effects are. So we have a bunch of stuff on that as well. We have Triple P teens. The different categories are vaping, drugs and alcohol, healthy relationships, healthy social media habits, budgeting, finding a job. There might be schoolwork, college might be one of them, but the main areas are focusing on those healthy relationships and drug and alcohol abuse.
Okay.
And social media habits, because that's been a huge concern in the high schools and things lately too.
the trend is, you know, when I first started doing this, there was a lot of, I do a Prime for Life program, and it was alcohol based more than anything else. And now I'm seeing it much more THC based.
Apparently drinking's not the cool thing anymore for teenagers. It's the vaping. So yes, and I know they got rid of the flavors, but we know kids have a way to find anything. So yeah, definitely conversations we can have. We're working with the schools to start some parent cafes right now with the younger families, but then going to be branching into teens. So it's something we can definitely do with that. And if we do get this youth housing thing, we plan on starting a youth, like we have a parent advisory committee right now. We'd like to get a youth advisory committee once, if we did get that funding, so that they can have a voice in how that programming looks as well.
Anybody else have any questions?
A lot of information, sorry. I'll email it all out too.
So we do offer parenting classes in the jail, but I wouldn't be opposed to having you just communicate with the
Yeah.
a assigned program director to see if additional.
Yeah.
Would have be a bad idea to have more than less.
Yeah, because we can do one-on-one group or however that would look too. So, I mean, if you wanted to look at groups, we could do dads, we could do moms, we could do, you know, just different groups too as well to kind of focus in on more of that support as well.
Just get me her
Yeah,
program director's email after this.
perfect. And I don't know if you guys offer that, that's at a cost, but it wouldn't be with this, so.
I think it's just a portion of our coordinated package with Dunn County and
Gotcha.
therapy.
Regards to the gas cards, you have a parent that isn't working but going to school, do you? provide-
School works as well too, yes. Yeah, if it's like I said, if it's something that's bettering their situation, if it's not school, work, or an appointment, but it's something important, they can fill out a request and we just have to approve it, so.
So what's the dollar amount that they usually get for a gas card, or is there?
We usually do 25, but if it's a further trip, we can do further. We've had a parent that had to go to Rochester for their child's appointment, so we did a $50 gas card. And there isn't really a limit to how many they can get, but if they ask us more than twice for things, we do some budget. Because again, we were getting burned, so we had to put in some budgeting. Yeah. So I wouldn't say that everybody, you know, takes advantage of it, but you know, you've got the few. So now that we put in budgeting, they don't call us anymore. So, you know, but. Yes.
What is the point of access? I'm assuming you don't take every call that comes in. But if anybody, any agency here
Mhm.
needed to find some, who they call, do they have to call a specific program?
So you can call Indian Head, but the direct number is 715-532-1589 to the Family Resource Center. And that number rings through to me, Allison, and Aaron. So it's all on our work phones. So if someone's in the office, they're in charge of answering the phone. If we're all out, we have a designated person answering the phones those days. So we always have them, because we also have a warm line thank you for mentioning that, because families can call or text us after hours. I call it a warm line because it's not a hotline. I'm not answering right away. I'll get back to them in a couple hours if it's the weekend. But we do have a warm line that I do check. Like, we've had parents on the weekends tell us, you know, especially our home visiting program, like, I can't do this. I've got my baby. I'm afraid. So we've had a home visitor go out and sit with them till the police came. So we do have that warm line for support to ensure safety of children on the weekends. So parents can get a hold of us or text us after hours as well. We know parents like to text, so we get a lot of texts after hours, and I'm good with answering those. I just don't want to sit on the phone all night with people, but I will if I have to. Also live in Jump River, so my cell service is not great, but yeah, so that's how you can get a hold of us. There's 3 of us that are constantly using or on that line. We have a schedule of who's in charge of the phone on what days.
Anybody else have any questions? Our next item on this agenda was court security update. Annette asked that be put on. Obviously, she can't be here today. Can anybody enlighten us as to where she was going with that, or what changes we've made, or anything like that? Otherwise, we'll postpone that and put it on the agenda for our next meeting, whenever that happens to be.
I think, and it may be that they are looking to change the court security position from a part-time to a full-time position. They are having difficulty keeping somebody in that position for any length of time. Time versus full-time is the biggest problem. So it's being considered, and we're looking into options from the sheriff's department on how we can change staffing classifications and figure out how to make that happen. And coordinate with the judge on that.
Assuming there wouldn't be any need for court security at any particular time, would they transfer to other duties then?
Yes. So if let's say it's a day and the judge is out, or just there's no court duties, we paper services in the community, since that's a court function and people need to show up at court, the officer would then into that phase during the day. Just make contact with citizens out in the community saying, hey, here's your summons paperwork. Make sure you show up this date, this time for this case.
Okay, and is that before the county board now or right now?
It's in
The job description or?
it's in transition right now. They're working out the change of the job description and then or to put it to a proposal to the county.
Okay. You're gonna keep us posted, and that's gonna keep us posted on that.
As I get information from it, right now the sheriff's taking care of it, but as I get info, I can let you know.
Okay. Jack or Emily, do you have any insight into security at all?
So that it's been a different person every day and they're just filling it in as they're available to do. And also as court hearings occur, we don't have somebody there all of the time. So when a hearing is set, I know that the sheriff's department will get somebody in there, but so it's,
Overtime.
what's that?
Some of them don't mind the overtime.
Yeah, and that as well, which the issue is that we don't have a consistent person. So maybe identifying common persons that are issues in court or that may be an issue, but if they're working on it. That's what I know.
Yeah,
Now, if they're looking at full-time, they couldn't pick up retirees on that because there'd be a challenge with the state retirement system and
as long as those people have out of the service for like a year, but they still need vacation.
okay.
We have some people that don't.
Okay. Judge,
Could we maybe have it on an upcoming agenda item, a report from the Court Security Committee, the one required by Supreme Court rule, as to what the security issues let's put it this way, it's broader than just having an officer in the courtroom. I mean, there's lots of issues related to court security, and that's the function of the mandated county court security committee. So maybe the chair of that group, whoever it is, I don't know. But I think, again, it's a larger issue than just how much courtroom law enforcement do we have? Much bigger than that. And there's a whole reporting system required. I think at least quarterly, you have to report to the state courts as to what your security issues are, what you're doing about them, those kinds of things. So I would like to ask that be put on a future agenda.
absolutely. And we've all seen this and we've been up in court and most of us have been, or a lot of us have been in other court buildings elsewhere where the security is significantly tighter than what we have here, so.
Well, if what you mean by that is security exists in other places, then yes, but security is non-existent in this building.
We have several signs, Jack, that say what you should and should not bring into the courtroom. Are you telling me people are not reading those signs?
Did you ever see anybody speeding out in the road?
Never.
Who would break their rules?
I mean, those speeding signs really are effective, yeah.
So our next security and facilities meeting is December 18th. So if we want to maybe put that on an agenda item after
Yeah.
that date, because then we'll have a better update on what's going on.
When I was at, a conference not that long ago, the head of the Wisconsin court, I can't think what her name is. She's been here before, talking about, security in the courtrooms. Her first question to all of us was, when was the last time you had active shooter training at your courthouse? So that is one of the big things that,
The last time we had the active
I
shooter.
don't know.
It was I was involved in one, at least I watched one in 2022.
It was several years ago, I think.
Yeah.
Yeah, 2022, I think was the last one we had.
Mr. Willingham.
Yeah, thanks, Mr. Chairman. Two things. One, the security officer position matter is on the agenda for the Personnel Committee, I think on the 6th of November.
Whatever you
And-
guys have,
yeah.
The sheriff's really mostly in charge.
I've seen it, so, I'm guessing that the personnel committee will be amenable to that change, because it's obviously, a better, situation than what we've had. Not that any individuals that have been involved in court security have, not done a good job. It's just the idea of having a focused individual, but if this body would want to go on the record of supporting that proposal, I would be happy to take that to the personnel committee when that issue comes up.
Would you like to put that to a motion?
Sure.
We have a motion for CJCC to support the full-time court security position. Am I wording that correct?
Yes, court security officer, I think
Okay. Do we have a second on that motion?
Okay.
Motion has been made and seconded to support the court security officer full-time. And says support onto the county board personnel committee. All in favor of that?
Aye.
Opposed?
Thank you. The other issue, I think that maybe CJCC could take a position on as well, and that's the overall courtroom security issue that you alluded to. And I agree that it's not good. But I also believe that the county has not taken court security very seriously for a long time. Back in the reign of terror, when I was county board chair, I attended those meetings, and I don't know that, I'm certainly not criticizing the current board chair because he's very, 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 very busy. But I think, we need to encourage the county leadership to get involved in that issue and, get to those meetings and take what the content of those meetings seriously. I haven't been to one for a while, so I don't know who is representing the county other than perhaps the administrative coordinator. I don't know. Is she there or not?
Well, the last one was canceled. I don't quite remember the
I
one.
think she was there before, but then got locked out. Yes.
Yeah.
So she was there.
For part of it, yeah, but that was not her fault.
But it definitely is not a significant priority on the county's priority list. So if there's a way to this body to say, take this seriously, I think there's an attitude amongst the board, at least, that this is big city stuff. Terrible things in courtrooms don't happen in small, friendly communities like Ladysmith. And
So they do.
I can guarantee you that there have been more than one kind of cringy thing that's happened in the last month. And I'm not telling you that because I was there. I can just almost guarantee you that there's things going on every week in the courtroom that could be serious matter. So once again, I'd be willing to make a motion that CJCC pen a letter to the county board chairman, who I will assuredly will respond and maybe try to beef up the county's involvement.
I was just asking if we wanted to amend your motion to include a letter to CJCC in regarding not only the position, but to enhance court security.
Yeah, we can do it that way too.
You had sent her to the county board, you said
Yeah.
CJCC.
I think to the county board chairman, you can copy in the administrative coordinator if you want to. But you can see from the attendance record here at CJCC that both of those individuals are members of the CJCC. We haven't seen them for a while, and I certainly understand county board chairman has employment responsibilities. He just can't attend every meeting. Be nice if someone from administration would regularly attend so that we could have a communication channel there, but
Yeah, I think we've all heard Mr. Willingham's motion and the details. Do we have a second on that motion also?
Second,
It's been made and seconded to draft a letter to the county board to encourage enhanced courthouse security. And I believe we had an evaluation done to follow those standards going forward, if I'm not
Yeah,
mistaken.
it's there. I just talked to Lori about it not that long ago.
Yeah,
Can I add something?
that's
I
been,
don't want to interrupt, but I agree courtroom security is important, but I also think that just the courthouse security is very important because I have been here for over 11 years.
it's the beginning of
We have,
security.
we have had so many employees come and go, get these keys, at least in human services. I don't know what everybody else gets. I have no idea who is keeping a log of who has a key, who doesn't have a key. I have no idea who has access to confidential records on my floor. I don't know if other individuals in this building can get into DHHS offices and look at records. I don't know that because there's not an actual record anywhere that I know that these are being detailed, like a detailed log of who has what key and who has access to what, because we have HIPAA records, we have CPS records, child support record, there's IRS records. And I'm not being a jerk, but I don't think anybody on first floor should have any access to what's happening on second floor for people's confidential information. And I know that some people have had access to certain things, and I will take a stance right now that I disagree that anybody outside of my department should have access to CPS records, to the HIPAA records, regardless if it's email records requests or whatever. That shouldn't be happening. So I think that the security issue is a way bigger issue than that.
I can guarantee you that they don't change the locks every time
I know.
one of your employees resigns and leaves.
Who they receive their keys from? Who do you receive those keys from? Is it from maintenance?
So typically what happens is if somebody leaves, the supervisor has that. But I'm saying that this has been a practice for many, many years. I don't know where all of these keys are, and I don't know if there's an actual log as to how many of these keys were made and where they are now. That's my point. Since I've been the supervisor, in children and family, I would get those keys, give them to the new employees. Now IT is really good about taking the badges and shredding the badges and things like that. I just think that there's a lot better things that we could do to keep this courthouse as a whole safe and protected, even against liability from somebody coming to sue us because their CPS records got leaked because somebody who had access to that shouldn't have.
I think we would all be shocked on what those particular keys open besides what's in your department. I know when I was downstairs and I had the key to the office downstairs here, and I thought, God, I needed to get it at something in one of the storage rooms. What if this key works for that? Yeah, it worked for that. You know, so it's kind of amazing.
There were at least a half a dozen people on the first floor that had keys to my office. I had an office. So, you didn't leave anything on your desk because you didn't know who had access. I believe that, this goes back a year or two, but there was something in the budget at one time for
The readers to be.
reader locks in the courtroom area, and
Yeah.
somehow that never happened.
Yeah, because those can get deactivated if somebody doesn't turn something in. Like if there's a reader thing, if somebody gets fired and doesn't turn their stuff in,
Yeah.
it can get deactivated. So they.
Yeah, it's all has a master
Yeah.
software, but the county agreed to buy those, and then they did, but they ended up being installed somewhere else. But the downside of that is that they're getting more and more and more expensive. And that's something.
Well,
I believe they're in clerk of courts, correct? That's when clerk of courts had their big update.
I'm not sure.
I don't know, but they were there not that long ago discussing getting readers for the courtroom, and I don't know whatever happened with that. I know they had the guys there. It was not that long ago that they had people upstairs looking at it, and I don't know whatever happened to that, because they were talking about who needed access to what doors up there. I don't know what happened.
No, the keys on the third floor, from my time in the DA's office, they'll open like every door.
Well, the push button codes on most of the
And now
doors
we have-
are the exact same thing throughout the courthouse.
Yes.
Yeah, that's my point. I shouldn't be able to just use my key and go into the DA's office and look at whatever I want.
For the record, I have no keys to open anything on any.
I mean, like
I'm a public defender now.
should have a certain fee. We're in Mess County.
For the record, the DA doesn't have a key to his own office. Oh,
Yeah, the DA has to knock to get into his own.
Whatever comes with a big deal, just use mine then.
Ashley's will probably let him.
So just borrow Ashley's, yeah.
But we're right, and we're kind of thinking lightly on this, but you're absolutely right. There basically is no security in this building to speak of whatsoever, as compared to probably the highway shop has greater security than we do. I'm not sure, but yes, Judge.
Two quickies. One, you're absolutely correct in the topics you just brought up should be part of the discussion in court security committee. Definitely.
It's on the agenda for the
It is.
for the next meeting.
Yeah, it's not just the courtroom, because you gotta go through a lot of places to get to that courtroom. And a lot of different records and all those kinds of things. So definitely that needs to be there. The second thing I
The
just,
courtroom is not the place to stop.
right,
It should be stopped before somebody even gets in the building.
right. The other thing I just wanted to mention for any of you who are in a position to affect this, one of the things I did in my annual budget to our county board was put in an amount. There's an annual 5-day training for court security personnel. And I made sure that our chief of court security went every year. And that was just unbelievably beneficial. They came back with all sorts of new ideas for how to make things more safe. And they would report to our committee and we would adopt certain things. They had access to people who did free services, including training to us that they met by way of that conference. We got equipment. But somebody'd say, well, you know, if you need this for your court security, I know where you can get some for free. And those kinds of things. So I don't know whose budget is impacted here, but no matter what the situation is in terms of who's gonna do courtroom security, definitely get them that training. Somebody put it in your budget. It's worth every single penny.
We also need to use what we do have. I have a metal detector and I don't know that it's used.
Is that a 5-day training you said? And where's that at?
It's one of the technical colleges in eastern Wisconsin that does train. I think they're also the ones that do the training for the officers that work in the jail. There's one technical college in Wisconsin that specializes in that, and they put on the annual conference. There's also a national conference, which I sent our head of security to a couple of times, but
If you have any information on that, could you send that out to me and then I will find out whoever's budget that might need to go into, but.
I always put it in mind because it's gonna happen. It's gonna get removed.
It's Fox Valley Technical.
It's not.
There you go. Just thank you.
Yeah, it is done. So,
All right, the next item on the agenda is progress in jail population and the new radio system. Tom, that would be your area.
Sorry, I was in conversation. So
You got the next agenda.
Pay attention, Tom.
Progress in the jail population and the new radio system.
progress in the jail. Well,
There isn't
we
any.
have another jail build meeting actually right after this at 9:30. So it's a funding issue for jail building. Programming's going well. Radio upgrade is completed and working great. We're in, what do you call it? We're past even the tear down of the old equipment, old towers and all that, and transitioning into just the maintenance and support aspect for the first year of go live.
Okay. Has that resolved the dead areas?
I would say so. Right now, the only issue isn't from our side of things. It's more often like the older radios for EMTs or firefighters if there's any issues, but most of those reprogrammings have gone very well. But they have older equipment, which obviously we didn't replace because that's not on our budget. The new system it's way better. Like, we have massive coverage. We have a ton of punch out. EMTs have heard us over in Rhinelander, as far south as Chippewa Falls. We don't hear them, but that's it. We got a lot of punch now. We got a lot of coverage. As long as you're not, inside the building. But
Okay.
a radio project, like, you have to people, everybody coordinating that and making it happen. Did a good job. It's a good company. And the service to the community is a lot better now.
Has there been any significant changes in jail population at all, or?
No, right now, we're not having any super high numbers, mid-20s, 30s. So, move forward with the emergency medical dispatch aspect for 2025 PSAP grant and 2026. So I've got the first 3 senior dispatchers starting their 6-week course along with myself to make sure that we understand EMD. We're going through the EMD cards for what will be expected of our dispatchers when we go forward with higher level of service to the community for dispatching. Unfortunately, we still don't have 2 people assigned to dispatch 24/7. Still be a step in the right direction. So if anybody out there has any questions about EMD, it's a 6-week training course provided APCO International, probably one of the biggest providers for emergency medical dispatch training and guide cards. And it's just a system that if yes, if no system. So you ask questions, everybody gets these guide cards, and it helps lead you to provide appropriate asset assignment, appropriate EMS, fire, law enforcement for calls across the board. It's enhanced training. Good. If you haven't ever looked into EMD, that's fine, but I suggest at some point just Google it, see what it entails.
Is that it?
For the training's online right now.
Okay.
They will have, it's a lot like the new online college course where you post every day, have like 10 assignments a week. Unfortunately, I can't assign people overtime for it. It's pretty in-depth, so they just have to work around the regular work schedules and try and get in, do their studying, read their chapters, answer their posts. And then there are a couple of live Zoom courses where they have to pick one day where they have to be available to go online and do like a 2-hour Zoom course. And there's practical applications, and at the end, everybody who passes is certified. It's required that if we are doing all these PSAP grants, we have EMD following their rules. So they have to be certified beyond just the basic training that the county provides for dispatchers at this time.
So I heard probably only yesterday that in 2026, AI is going to be brought into the dispatch center as well. Is that just to
So,
coordinate calls or just transcribe?
so APCO is looking to enhance the service that they provide. So once we found out, before I came on board, the last administration started the EMD thing, the grants and all that. They decided that we didn't need to have the electronic versions of these guide cards, and they were just going to go with physical ones. So right now, we're going to get physical ones. I've already sent out requests to the people involved to say, no, we're going to upgrade, let's make steps to upgrade to the electronic ones. AppCo is going to include in their electronic program the software for AI. And during call taking, the AI is like background listening. And if it hears certain key trigger words, it will open up guide cards automatically for the dispatcher. So let's say you're taking a call for a lady who's bleeding and in the middle of the roadway. And during that time, at some point, there's something mentioned of a weapon or somehow domestic violence, any of those key trigger words, and the AI is going to trigger the domestic violence. Or maybe they talk about amputation or somebody's like, something's missing, the amputation guide, like, so that's AI support level in AppCo, and they want to go live with that in 2026. So us onboarding just before they go live with that will be an interesting thing to see as we get on board with the MDE, we go live with it, and then hopefully some point. Go live with
These
that.
guide cards then are telling the dispatcher what resources to send to that particular call.
We're not replacing people.
No, it's not.
Questions as they talk.
Yeah, it's a support. It's a tool, just like anything else, you know, like a map on the wall. Map is great, electronic map. And one of the other things that we're reaching out to.
I mean, it depends.
Yeah, and we're trying to do like, so just as the career gets more and more complicated and more things come on board, we need to have ease of support. And one of the other things we're doing for road and dispatch is quickest routing module. We're trying to get that unlocked through Motorola. It's great that we can say, hey, we got a call here. I know where that's at, you know where that's at, but maybe the one new guy who's off training on the road doesn't know where Breakneck Road is off the top of his head. And now he's got to go hot to one of the furthest points of the county that he doesn't go to a lot. Well, it's another aspect of this whole thing.
Tom, I don't want to cut you short.
I know, I'm talking
I'm
too
gonna
much.
get Recovery Court,
Yep.
budget in there quick before we have to close up. So Angie. Recovery Court grant budget and housing concerns. You can do that in 2 minutes.
Housing concern. So the grant has been submitted. Haven't heard back if it's been approved. I tried logging in this morning and then logged myself out of it. So, as of right now, with it being a baseline year, non-competitive year, we were instructed that basically every county that was awarded a grant last year would be awarded the same grant this year. So there was no additional items that we could request. Everything pretty much had to stay the same across the board. So this year, our grant requested for the budget amount requested from the grant, excuse me, was $162,992. Of that, $122,244 is coming right from grant money or from the grant budget, and $40,748 of that will be the match for it. 65,000 of that is personnel, 27,000-ish is employee benefits, 7,000, almost $8,000 in travel requested, and $8,200 for supplies and operating expenses, $34,000 for consultants and contractual. That includes our contract with the Family Health Center, monies requested for inpatient treatment facilities, all of our testing companies, like our forensic fluids was a big chunk of that. Every time we order a test, it's $25 a test. And then we also have our electronic monitoring on there, and our silver links and our sweat patch monies come out of that. And then $18,000 was the indirect costs, overhead, all that for cubic square feet and all that for upkeep. So that's where we are currently at. And like I said, I have not heard back anything about that. So that's where we're at. As far as housing, it's not so much a housing issue because there's housing out there. It's whether or not a person who is applying for housing can get accepted for housing based on what happened previously to them. And there's only so much that we can help them. We can't, we could send out letters saying, hey, I am, recommending this person for housing, but we can't change their backgrounds. We can't change their background check. We can't change their criminal history. And that right there is the biggest problem when it comes to finding housing. Like I said, there's housing out there, but it's what you qualify for, and we can't fix that.
Sorry, I know it's another meeting to go to, but if folks want to talk more about housing in Breast County, Salvation Army leads the Rural North Homeless Coalition. And it's where a bunch of people come together to talk about the housing needs in the service area as well as barriers. So if folks want to go to that, I know that might be something that might help with that conversation.
When is that?
I will, I should know, I take the minutes for it. I will send an email. I'll send an email.
Any questions for Andy? We're running a little bit over, so we're not gonna get an update on truancy court or RRYP. I will make sure that goes on the agenda for our next scheduled meeting. Now, we're gonna have to discuss that because our next normal scheduled meeting date would be Thanksgiving Day, and I don't anticipate any of you would want to be here on Thanksgiving Day. So, any suggestions? I'll have to see if the room is available, but are we gonna have a meeting in November? I guess that would be the next question. Then can we do second or correction, Thursday or second Thursday? Any thoughts on that?
The issue is going to also be that November is conference month.
A lot of people going.
And what I mean is that Jack and I are both going to be gone, I believe the second week of November. So the 13th is SPD conference in Spet. The judicial conference is usually around that time as well.
Vote to skip it.
Skip November? Want to make that a motion?
Sure.
We have a motion on the floor to skip November.
Before we do that, when does Christmas fall?
It's gonna be the
Thursday.
Is
fourth
the,
Thursday of December. Okay.
Same day as last year.
So we're gonna find ourselves in the same problem in December.
We will have to have December because that's a program review committee month, which we could put RRYP on as a program, as part of that review committee meeting also. So that's a reasonable thing to have for there. We could change the Thursdays on this. I don't think anybody's gonna be here Christmas Eve or Christmas Day either, so.
Well, so December 18th is the security meeting in the morning for Ross County. So we would have to look at December 11th. We're missing a November meeting. Probably wouldn't hurt to go a little bit earlier in them. I have no.
First of all, we got a motion on the floor. Judge Stewart's motion to skip number. Do we have a second on that?
Second.
Made and seconded to skip November. All in favor?
Okay.
Opposed? I will look at December 11th.
I was gonna say, since you're eliminating November, earlier date in December would be appropriate, yeah.
I agree.
And right now, there's nothing on the calendar for December, so
Okay.
first come, first served.
Speak for yourself.
I on this calendar, not your calendar.
All right. Motion has been made for December 11th. Second for that one.
You will probably not see me at that. I have, I think, 4 days in December that I'm not in trial, and the 11th is one of those days that I am in trial.
There's a lot of trials coming
I'll
up.
second them.
That means that the judge won't be here.
That one.
Okay. What do you have available, Jack?
In terms of Thursdays, 4th, December 4th. I have, I'm,
You know, third week of December?
well, I've got the trial on the 18th. Um,
We have court security. It's gonna be that morning. And so if that's, did we say it was a quarterly review?
Yes, it should be.
Yeah, and so we're gonna probably run into that.
Just to go to the fourth
yeah,
because.
so you're not gonna,
It's kind of a split between,
Let's do a December, November meetings.
I'll have to make sure this room is available, but you want to change your motion to December 4th?
Sure, that sounds great.
Okay. Second on December 4th.
Second.
I actually can make that.
All right. I'm going to take that as your second, Jay.
Yes.
All in favor of December 4th? Opposed? Have a motion to adjourn the meeting. No, nobody wants to leave. Tom motion to adjourn the meeting. Second.
I'll second it.
Any opposed? Cut that short. Thank you, everybody.
Busy meeting.
Anymore?
Why? Because you don't.
20 minutes, I gotta be-
Motion any- or-
You're right. Yeah.
Guess I might still.
Back in here.
Ashley thirded it. I go read the minutes. I go, I didn't do that. Oh, that's Ashley.
Still not me.